Hi, I'm Chantel Hasman, and I'm a physical therapist at Froedtert Medical College of Wisconsin. I received my education from the University of Wisconsin-Madison and graduated in 2005. I typically treat athletes of ages from the range is about 12 to, mid-30s typically, but we do have some adult athletes that are still going strong in their 50s to 80s. I work with athletes from all different sports, essentially. Quite a few football, because I'm in a sports performance facility. So quite a few football, but definitely I've got my soccer athletes, lacrosse, baseball, parkour, even some random, wrestlers, MMA fighters, so a pretty wide range of all athletic abilities. The specific conditions that I treat, a lot of times there are post-op, like your ACL repairs, your shoulder surgeries, labral scopes, that type of thing, labral repairs, I should say. A vast majority is really for those athletes that haven't quite ended up on the surgeon's table. So they're really just looking to continue high performance levels, but they're having aches and pains or limitations to get them just to be able to train and continue their performance that they're used to. My practice philosophy is really pretty simple. It's threefold. I would say listening is first and foremost most important, trust and individualization. So the listening is I work very hard at staying current in the most recent literature and innovation. But if I don't listen to that person that's right there in front of me, if I don't know their motivation, I don't know their goals, then neither one of us wins. And then trust, with physical therapy, it's not typically a one and done, that we have a recovery period. Rehab takes time, changes take time. And so during that time frame, we develop a relationship and understanding a rapport, and that you're going to have good days, you're going to have bad days, and we need to understand that overall the trend will be towards improvement, but we will change it as needed. And then with the specialization, every person's different. You may have two siblings that are in the same exact sport, perhaps in the same exact team, but I'm going to treat those two siblings very different based on, their specific skill set. So understanding where each individual is coming from. I absolutely love what I do. I stumbled upon PT. In actuality, I was home from college, and actually a grade school friend of mine was looking into PT, and I didn't know what I was going to do. And so she described it. And when I came home after winter break, actually over the holidays, I job shadowed at a hospital and just kind of got the bug. I loved it and continued volunteering. They hired me, and it just snowballed from there. And I've never looked back, and I've had quite a few patients that somehow they've aged quicker than me, but they've actually gone on to become PTs later. So I love what I do, and I have the best job in the world.